Your patient has just arrived from PACU after a parathyroidectomy surgery. Now, within minutes, they begin complaining that their lips are tingling. Woo! Is this normal? Or could it be the first sign of a life-threatening complication? Hi everyone, welcome back to my channel. My name is Nance. I am a medical surgical nurse, and on this channel we break down complex nursing topics into simple practical lessons that you can use on the floor. Today we are covering the first 5 minutes after a parathyroidectomy surgery. One of the most important assessments you will be performing as a nurse. So whether you are a new graduate, a nursing student, or even an experienced nurse looking for a little refresher, don't go anywhere. This video is for you. Now let's get started. Why does the 5 minutes even matter? Okay, before we jump into the assessment, wait. Let's quickly review why this surgery even deserves special attention. You know, the parathyroid glands are 4 tiny glands located behind the thyroid. Now, their job is to produce parathyroid hormone, or PTH, which helps in regulating calcium levels in the body. Now, after surgery, patients are at risk for so many things. For parathyroidectomy surgeries, your patients are at risk for airway compromise, neck bleeding or hematoma, hypocalcemia, and recurrent laryngeal nerve injury. Now, the good news, if you know what you are looking for, you can identify these complications very early. So here is where I come in. Step 1, airway first. Now remember your ABCs. Before you even touch the dressing or anything, ask yourself, can my patient maintain their airway? Now assess their respiratory rate, their oxygen saturation. Are they using accessory muscles in breathing? Are they able to speak in full sentences? You also want to listen carefully for stridor, hoarseness, difficulty swallowing, any noisy breathing. Also check your patient, make sure the patient is not constantly swallowing, because that could be a sign of blood trickling down. Okay, remember this. If you notice any hematoma, you need to report it promptly. Okay? Now some red flags you need to know. Neck swelling that is rapidly increasing, difficulty breathing, stridor, tracheal deviation, severe neck tightness. These are red flags you need to watch out for. Now, if you suspect any airway compromise at any point, stay with your patient, call for help, make sure their head of the bed is elevated, connect them on oxygen, notify your surgeon or rapid response team in your facility, and get somebody to prepare for emergency airway management. Okay? Now, step 2, I want you to assess for bleeding. Okay? You want to inspect the surgical site. What for? For fresh bleeding, for dressing that is saturated, swelling, bruising. You want to be checking that. Now, here is the common mistake most nurses make. Many nurses only check the front of the neck. Okay, I don't want you to be that nurse. Instead, you should gently inspect behind the neck and the shoulders, because blood may be collected underneath. Okay, so don't just be the other nurses and just check in the front. Make sure you do the whole 360. Okay, now you want to monitor for signs of bleeding, like check your patient's blood pressure, their heart rate, drainage output if they have any drainage tube inserted. Now remember this, a neck hematoma is a surgical emergency, so you want to be very, very vigilant. You also want to be watching for hypocalcemia. Now, this is probably the most tested concept on exams and one of the most important complications after parathyroidectomy surgery. You know, because the glands regulate calcium, and calcium levels can fall after surgery. So you want to ask your patient, do you have any tingling around your mouth? Any numbness in your fingers? Any muscle cramps? Okay, because your early signs of Hypocalcemia includes tingling around the mouth or the lips, finger numbness, muscle twitching, and anxiety. And your severe hypocalcemia causes tetany, carpopedal spasms, laryngeal spasms, even seizures, and QT interval prolongation on your ECGs. So you always want to make sure you're monitoring your patient's calcium 100%, their magnesium, their phosphates, and also their PTH, that's the parathyroid hormone, if it is ordered. If available, it is always appropriate you also check for ionized calcium, because that provides you the most accurate measurement of a biologically active calcium in your patient's body. Okay, now step 4, you want to be checking for the Trussel's and then the Vostok signs, and that is usually an NCLEX text when it comes to hypocalcemia. Okay, so if you suspect anything like hypocalcemia in your patient, the Vostok sign is basically you tap over the facial nerve just in front of your patient's ear. If the facial muscle starts twitching, then it is a positive sign. And then your Trussel's sign, you basically inflate a blood pressure curve above your patient's systolic pressure for about 3 minutes, okay? If the patient's hands go into a carpopedal spasm, something like this, whilst you've inflated the curve, that is suggesting neuromuscular irritability from hypocalcemia. Now remember, these signs can support your assessment, but it should be interpreted alongside the patient's symptoms and laboratory results. Okay? Now step 5, you want to be checking the voice. Ask your patient, can you tell me your full name? Why do we even do this? Because during surgery, the recurrent laryngeal nerve can be irritated or even injured. A mildly hoarse voice immediately after surgery can occur, but if it's persistent or is worsening, especially making it very difficult for your patient to breathe, you want to be reporting that promptly. Your 6th step is to be prepared. What are you preparing for? Always ensure emergency equipment is readily available, and that includes your oxygen, your suction, any emergency equipment you use in your facility, make sure it's readily available. Now, in severe symptomatic hypocalcemia, if they do develop, IV calcium, such as calcium gluconate, may be administered according to your provider's orders. So you want to make sure you know where IV calcium gluconates are kept in your facility. Always make sure you position your patient with the head of the bed elevated above 30 degrees to reduce swelling and also promote comfort in breathing. Okay, so let's do a quick review. Let's recap the first 5 priorities after a parathyroidectomy surgery. I want to make it simple. Remember the acronym ABCVC. So A is airway, B is bleeding, C is calcium, V is voice, and your last C is to call for help as soon as you notice any complications. Okay? Now, if you remember these 5 priorities, trust me, you will be prepared to recognize the most important post-operative complications. Okay? So if this video was helpful, please give me a thumbs up, like, share, and subscribe to my channel, Med-Surg Decoded RN. And also leave in the comment section what post-op surgery you would want me to cover next. Being a hip replacement, liver transplant, and all that. Just feel free to name it. Thank you so much for watching, and remember this: great nurses don't just react to complications, they actually recognize them early. I will see you in the next video. Thank you. Bye.